Good morning. I'm Jennifer Stayton. You're listening to a special hour of Morning Edition focusing on the coronavirus from KUT in Austin. The numbers change almost minute to minute, and in the absence of widespread testing in the U.S., the numbers we do know are likely lower than the reality of the situation. As of this morning, there are about 128,000 confirmed cases of COVID-19, the disease caused by the coronavirus, worldwide, about 1,300 in the U.S. There seem to be almost hourly developments related to coronavirus, but we want to spend this hour talking about the virus itself, the disease it causes, and how it's impacting our health, lives, and world. For the past week, we've been taking listener questions about all things coronavirus and have assembled a panel this morning to answer some of those questions. Let me introduce them now. Serena Bumpus is the Director of Practice for the Texas Nurses Association. She was previously Regional Director of Nursing for Baylor Scott & White Health, a clinical nursing manager at University Medical Center Breckenridge, and worked as a registered nurse at Stayton Medical Center. She's been in the nursing profession for over 18 years. Dr. Parker Hudson is Assistant Professor of Internal Medicine and Infectious Diseases at Dell Medical School in Austin. He's also the Program Director for the Internal Medicine Residency. Among his affiliations, he's a member of the Infectious Diseases Society of America. Lauren Ancel Meyers is Professor of Integrative Biology and Statistics at the University of Texas at Austin. She was trained as a mathematical biologist, and her research includes building models to predict and control outbreaks. And Jeff Taylor is Senior Epidemiologist with Austin Public Health. He's been an infectious disease epidemiologist with the Texas Department of State Health Services and the City of Austin for over 38 years. He's currently a manager of the Epidemiology and Disease Surveillance Unit of Austin Public Health, the unit responsible for infectious disease surveillance and rare disease or outbreak investigations in Travis County. Thank you all for joining us this morning to answer our listeners' questions. So we want to go ahead and dive right into those questions. We have a lot of them to get to. Our first question is about transmission.
Hi, I'm Leanna Mills from Hyde Park in Austin. Can you explain how the coronavirus is transmitted from one person to another?
So how is it actually transmitted from person to person?
Go ahead, Dr. Hudson.
Hi, this is Dr. Parker Hudson. The transmission mechanism is almost certainly from large droplets, which means when you cough or sneeze, you shed viral particles that go into the environment, usually within about a meter of your distance. The role of transmission of contact, what we call fomites, environmental surfaces that can be contaminated with the virus, and the contribution of airborne virus is still unclear.
So if somebody coughs, how then am I going to get it from them? Do I get it by wiping my hand and then touching my nose or mouth? Sort of finish that transmission loop for us.
Right, so once the droplets are on your hand or your skin, and then you touch one of your mucous membranes, your eyes, your mouth, your nose, that is the portal of entry into your body. With that, this highlights the really important messaging around cough hygiene and hand hygiene.
And we'll be getting to all of that throughout the hour. Most definitely, we had lots of questions about that. Lauren?
So there's another question we should be asking at the same time, and that is, when is someone contagious? When might someone transmit? Right?
And we definitely have questions about that also. So we have questions. So for example, if someone is asymptomatic, so if I'm not coughing, I'm not sneezing, I don't have a fever, is it possible that they're infected? Could they be transmitting it during that time?
Yeah, that's exactly the question I was getting to, right? So yes, if you're coughing, if you're sneezing, there's a clear possibility for transmission. But in work that we have done at UT and work that people have done around the world, we have seen evidence that a reasonable fraction of cases have actually been infected by people who haven't yet shown symptoms. So they're not coughing yet, they're not sneezing yet, and yet there's evidence that they're able to infect other people.
So asymptomatic transmission, definitely a possibility, it sounds like.
Yes, and actually in that case we call it pre-symptomatic transmission. Those are people who do eventually develop symptoms but haven't yet.
So local health departments are looking at a time frame for those cases who are ill the 2 days before onset of when they may have been infectious. So if we're identifying contacts to a known case, we're looking at We need to know when their onset of symptoms was, and then we'll look for that 2-day period before, because we consider them potentially infectious during that period, in addition to the time frame when they do have symptoms, which may be up to 12 days.
And we do have a question about how much exposure you actually need before you might become ill.
Hi, my name is Michelle Reinhardt, and I live in Austin. My question is, how much exposure do you need to become ill? Is it similar to the flu, or is it easier to contract?
We got a lot of questions about comparing this to the flu. How about in this particular regard?
You know, we have some knowledge for other viruses. Norovirus, which causes a vomiting diarrheal illness, we say it takes very few viral particles. I don't think we really know with this virus how many viral particles it may take, 10 or 110. That's still yet to be determined. But from a public health standpoint, we would say you need to protect yourself. And if a person is coughing or sneezing or appears sick, stay away from them, because you don't even be exposed to even one viral particle.
Right, so you said stay away from them. We got some questions about, we've been hearing about social distancing, but I've seen 3 to 4 feet, I've seen 6 feet, 12 to 15. What is an appropriate and effective distance to actually make an impact on this?
So I think we return to the issue that there is just a lot of uncertainty. So going back to comparing COVID-19 to influenza, there are things we know about them, about the contrast and similarities between them. They both seem to be spreading through respiratory droplets. We don't believe that flu spreads airborne, but we don't know yet whether COVID-19 spreads airborne. And as we learn more, public health experts, decision makers are issuing new guidelines. As of now, the guidelines are that 6 feet is a protective distance. But as we learn more, if and when COVID-19 spreads in communities in Texas, we need to keep an eye on public health websites, public health recommendations, because those guidelines might change.
So we heard just last night about UT Austin extending its spring break. The NBA has suspended the rest of its season, or at least games for now. NCAA says no audiences for their March Madness basketball games. This might seem like an obvious question, but talk about the strategy behind canceling a mass gathering like that. What is the thinking behind doing something like that?
Well, I think from a public health standpoint, we want to limit crowds where we know viral respiratory agents are transmitted. So in a stadium, even at the Irwin Center, there may be, if there's 12,000 people there, there's a great opportunity in the restrooms, outside the stands, but even in the stands, when you think of all those cheering fans, they're expelling droplet nuclei when they're cheering. And if one of them was sick, there's a high likelihood that the people sitting around them or the people who come in contact may also be effectively exposed.
And when we think about these, we sometimes call these mass gatherings. There's sort of two parts of it. One is the mass, and that's what Dr. Taylor was just talking about. People are gathered together in a way where they can spread disease to each other. But the other thing is the gatherings. And when we're talking about major sports events, when we're talking about South by Southwest, when we're talking about major events, when people are coming from all over the country and even all over the world, we're also concerned that people are coming from places where there is sustained transmission, where there is community transmission, into a city where there's not yet community transmission, and that can seed a new outbreak. And then people who are there, then they return to their home cities, and that can even propagate it even more broadly.
And one thing I'd like to add is that it is very clear that you are most infectious at the time of the onset of your symptoms, and we look back 2 days, but that's very clear. And the other thing, to add some numbers, we don't know how many viral particles you need to be exposed to, but when you look at the epidemiology of these infections abroad, about 10 to 15% of close contacts go on to develop COVID-19, the respiratory disease, and with effective isolation precautions of symptomatic contacts, we can reduce that attack rate to 2% or less, and that's the goal.
You are listening to a special hour of Morning Edition from KUT in Austin about the coronavirus with our guest Serena Bumpus, Director of Practice for the Texas Nurses Association, Dr. Parker Hudson, Assistant Professor of Internal Medicine and Infectious Diseases at Dell Medical School in Austin, Lauren Ancel Meyers, professor of integrative biology and statistics at the University of Texas at Austin, and Jeff Taylor, senior epidemiologist with Austin Public Health. We have a question now about sort of general health and getting sick, never being sick, and how susceptible people might be to getting COVID-19.
My name is Emily Day Bacon from Austin, Texas. My question is, I haven't been overly concerned about the coronavirus because my family and I are generally very healthy and we rarely get sick. How likely is it that those of us who are healthy with strong immune systems could catch the virus?
All right, so if someone is basically healthy, what is the likelihood or how concerned should they be about catching COVID-19?
Their risk of a healthy young adult's risk of severe infection or death is extremely low from infection. The concern is that we have to take this seriously and that young, healthy people, even if they have mild symptoms, are the source for the transmission throughout the population. And so we all need to take our symptoms very seriously to protect the most vulnerable, which in this epidemic appear to be people over 60 and with underlying health conditions.
So we have a question now about immunity and COVID-19 and coronavirus.
My name is Lauren Radner. I'm in Buda, Texas. My question is, if you catch the coronavirus and then get better, are you then immune to it?
All right, so if you do we even know that yet? I mean, there's a lot that we don't know. Do we know yet if you catch coronavirus and then recover, is there immunity there? Do we have any information about that as of
we
yet?
could speculate with a lot of viral agents. You do develop immunity, but even with flu, it's a viral agent have a lot of knowledge on. Just infection with one flu virus may not going to protect you from the other flu virus that may be circulating. But there is some evidence that in China they've actually used serum from patients with infections to treat people with acute infections, and it shows that it may work. So the antibodies produced are protecting that person who's receiving them, but there's no evidence right now coming out, or at least no findings that says one infection will protect you from another exposure.
Now, we've heard that the most vulnerable population is older folks, but we did get a question about the other end of the spectrum, young people.
I'm Michelle Downey Cranes. Have any children died from COVID-19, not just in the United States, but in any country? Are children considered a high-risk population for this disease?
All right, anybody want to speak to children versus older folks?
Yeah, there's not a lot of articles out right now about the clinical illness in children or young adults. But there are some suggestions it's different than flu. We considered young children, particularly school-age children, as the incubator for influenza virus in the community, where they spread it amongst themselves at school and then take it home to their parents. But there's no evidence now of what the role children may play, what percent who are infected have asymptomatic infections, and if they are asymptomatic, are they actually capable of transmitting to others? But I think that knowledge will gain. I think of the huge amount of information we've gained in the last 2 months, and things may change by the end of this month.
So we got a lot of questions about the symptoms themselves, especially in Central Texas where allergies are a big issue. And of course, it is also flu season and people wanting to know how they can differentiate among the symptoms.
Hi, I'm Rachel, and I was just wondering, how do seasonal allergy symptoms differ from COVID-19 symptoms? I'm stuffed up, I'm coughing, sinus drainage, headaches, and I feel just really drained. So it seems like what I'm hearing is like the main difference is not a fever. So is there always a fever with the virus?
So Serena, how about this one for you? What should people be on the lookout for, and how can they tell the difference between cold, flu, allergies, and COVID-19?
So it's my understanding that with COVID-19, the biggest differentiator is shortness of breath. And versus with the flu, you have the body aches that come along with it, and with seasonal allergies, you just have the postnasal drip and the congestion. So if you're experiencing shortness of breath, that's really that biggest differentiator that you
So shortness of breath, and I'm also wondering, Serena, about, I've heard the cough is dry. You mentioned congestion, but another symptom being the cough is dry.
Yes, exactly.
So some differentiators to watch for there. Other than flu-like symptoms, here's another question we got. What does the coronavirus do to a healthy person? We got a question about, are there gastrointestinal symptoms, any other symptoms besides the ones we've been hearing about?
So the symptoms are quite varied, and we're learning as we study different populations. I think we'll learn more about what mild cases look like. What we're seeing is that about 80% or more do eventually develop fever, but may not have fever on that first day of symptoms, which can include cough, shortness of breath, myalgias, the flu-like illness, without a lot of differentiating factors up front. Diarrhea appears to be a minor symptom in the sense that less than 10 to 15% of people will have diarrhea, and it shouldn't be a diarrheal-only illness. That should not be your only symptom for you to suspect COVID-19.
We did get some questions from people wondering about other underlying conditions they may have and how that might interact with COVID-19.
Hello, my name is James Winnetschlager, and I'm a young 32-year-old male. I'm concerned about the coronavirus because I have asthma, and I'm wondering, does asthma increase the chances of complications and or death from this virus?
All right, so if someone has asthma, how should they be thinking about the interaction with COVID-19?
So there are a number of putative high-risk conditions that...
What does putative mean?
Likely high-risk conditions, underlying conditions that we believe put people at higher risk for severe outcomes, at higher risk for hospitalization, severe disease. And the latest list from the CDC's website include medical conditions like blood disorders, chronic kidney disease, chronic liver disease, compromised immune system, pregnancy, endocrine and metabolic disorders, heart disease, lung disease, including asthma, including COPD, and neurological conditions.
All right, we got a couple questions about treatment, and we know that right now there's not a vaccine, and we'll get to that later. There's no specific known medicine, but we did get a question. If a person is confirmed to have COVID-19, what is the treatment in the hospital? What's likely to happen to that person if they're hospitalized? Are they put on a respirator? What is likely to happen in that situation?
So 20% of patients appear to need hospitalization. About 5% of the infected population ends up going on to be critically ill, needing additional respiratory support.
So we also got some questions about specifics. Do antibiotics work in this situation? We're getting everybody's shaking heads no, smiling. Talk a little bit about, we did get several questions about antibiotics. Are there any medicines, Serena, Jeff, any medicines that can work in this situation?
I think Dr. Hudson is probably more knowledgeable on that.
So this is a viral disease in which common antibiotics or any antibiotics that treat bacterial infections will not work.
What about antiviral medications? We got questions about Tamiflu. You know, if you're prescribed something or you take something to try to combat flu, would those work in this situation?
So right now, the flu epidemic, which we could also talk about, is still very prevalent in our area and much more common than COVID-19. And so if you have symptoms, they're still more likely to be flu right now, at which point oseltamivir would help you. If you have SARS-CoV-2, the name of the virus that causes COVID-19, Tamiflu or other antibiotics will not help you. Maybe later we can talk about investigational strategies.
So right now there's no specific medicine you can take that's going to help.
And the most important thing is that treatment right now is prevention. It's all the messaging that is being shared about social isolation, hand hygiene. That is the best treatment for all people.
So if somebody does believe that they have symptoms, or if they are tested, and we will get to testing right after our break here coming up in just a couple of minutes, if somebody believes they may have COVID-19, or if they do test positive and they're at home, they're in self-quarantine or self-isolation, what can they do then to treat that situation? Just treat the symptoms? Serena, what's the best thing to do if somebody has the symptoms or actually has COVID-19?
I do think the best thing for them to do is just to stay home and to do what they would normally do if they were to have the flu. They're going to hydrate themselves. They're going to keep themselves isolated in their homes, away from their family members, making sure that family members are wiping surfaces down so it doesn't spread to anyone else in the family, and to call their primary care physician and seek out the advice of their PCP.
And we're going to get to much more of that in our next half hour. We're going to talk about testing. We're going to talk about that preventative behavior and much more. This is a special hour about the coronavirus from KUT in Austin with our panel this morning, Serena Bumpus, the Director of Practice for the Texas Nurses Association, Dr. Parker Hudson, Assistant Professor of Internal Medicine and Infectious Diseases at Dell Medical School in Austin, Lauren Ancel Meyers, Professor of Integrative Biology and Statistics at UT Austin, and Jeff Taylor, Senior Epidemiologist with Austin Public Health. I'm Jennifer Stayton. You are listening to a special hour about the coronavirus from KUT in Austin. I'm Jennifer Stayton. I want to reintroduce our panel of experts joining us this morning to answer listener questions. Serena Bumpus is the Director of Practice for the Texas Nurses Association. Dr. Parker Hudson is Assistant Professor of Internal Medicine and Infectious Diseases at Dell Medical School in Austin. Lauren Ancel Meyers is Professor of Integrative Biology and Statistics at UT Austin, and Jeff Taylor is Senior Epidemiologist with Austin Public Health. We at KUT have been taking listener questions for about the past week or so about the coronavirus, and we're trying to get through answering as many of those as we can this morning. And the topic I want to turn to now is testing. We got a lot of questions, a lot of interest about testing. And first of all, I think sort of a pre-testing question is somebody just asked very basically, what are we supposed to do if we think we might have COVID-19? If we may have some of those symptoms that Serena was talking about earlier, fever, shortness of breath, dry cough, we think we might have it. Walk us through what we should actually do in that situation. Dr. Parker, do you want to start?
Yes.
Dr. Hudson.
So the first point is to call your physician, or use telehealth if you have access to that, to get medical advice to assess whether your fever could be due to another cause. If your only symptom is fever, then you do not need to, and you should not come to the clinic or certainly the emergency room of the hospital without notifying your doctor first.
So we got a lot of questions also. You said call your doctor, but is time of the essence here? Because sometimes when you call the doctor, it can be a day or so before you might hear back.
So fever alone is not the problem. It's the progression to shortness of breath. And when you're experiencing shortness of breath, certainly, if you have any symptoms of trouble breathing, confusion, then you do need to respond quickly. The natural history appears that this is actually a slower symptom onset than in flu, which is usually within 1 to 2 days, and these symptoms typically evolve over 4 to 5 days.
Lauren.
Yeah. In addition to reaching out to your healthcare providers, it's really essential that if you think there's a decent chance that you've been exposed to this virus, that you immediately take precautions to protect the people around you, that you immediately voluntarily isolate yourself. If you believe you may have exposed household members because they may already be incubating the disease, it's very important that they also take precautions. So we need to, at this point, err on the side of caution. Any steps you take to kind of isolate yourself will protect the people around you and the people around them.
And I just wanted to emphasize the point that Dr. Hudson made earlier, which is, contacting your PCP, everyone should know if their insurance plan or if their primary care physician has telehealth services available, because that is a great way to continue to self-isolate and get the help that you need as well.
And we had a specific question about where people can actually get tested for COVID-19.
Hi, my name is Abby. I'm wondering who is actually testing for COVID-19? Is this hospitals, health agencies? If someone presents to a hospital or clinic, how quickly will they be tested? And how long does it take for the testing to come back?
Jeff, tell us about the testing situation right now.
Sure, that's a great question. And I think the medical community and public health community have been dealing with this issue for a month. But testing just became available in mid-January. And in the United States, the only lab that could do that testing was at the Centers for Disease Control in Atlanta. So all the medical community in the U.S. was sending their specimens to that facility, but they had to go through the state health departments to get approval to test those specimens. Now, I believe all 50 states now can offer the test, although it may be a limited number. And there are some reference laboratories now that are offering the test. And I also stand, and all this has changed in the last 2 weeks, rapidly changed. Now Baylor, Scott, and White hospitals are now offering the test. So there's more labs doing the test now, so physicians have an opportunity to test more patients.
So is my primary care physician likely to have access to a test, though? How do I know? Do I call your office? Do I call my doctor? Do I call, where do I call?
Yeah,
I think people are really confused about how to start that process.
I think we've addressed that in some of the previous questions, that if you're sick with a febrile respiratory illness, you need to discuss with your medical provider. We still have influenza circulating in the state in Austin. Your medical provider can address whether you may have COVID-19 or flu or something else. There's adenoviruses, parainfluenza viruses. But if that medical provider in Austin needs to test a patient, they'll need to consult with the local health department. We'll get that clinical information, and then those specimens will go to the state lab.
And I just also want to be clear that the tests are not widely available. They are through Austin Public Health. At this time, things are rapidly changing, which means if you're having say, just a fever or a cough, we are encouraging people not to come to the clinic or the ER just to find out if you have the virus. That's really important because that can overwhelm the system.
So Serena, you had mentioned kind of checking in with your insurance provider, seeing if they offer telemedicine. We did get a question about testing and testing costs for people who don't have insurance, or also for people who may not even have a primary care physician.
Hi, my name is Brian. I live in South Austin, and I'm wondering how the city is going to address the cost of testing for those that are uninsured or underinsured.
Jeff, what is the situation if folks don't have insurance, but they feel like they want to get tested?
So for those patients, we have tested some patient in Austin. Our specimens go to the state health department, and Austin Public Health basically, I'm not saying we cover the cost, but the state is doing that testing for free. So the testing shouldn't, there should be no additional charge to the patient for the testing done by the state health department.
And if somebody doesn't have a primary care physician, but they feel like they may be having symptoms, so they can't make that call that you all were referencing about check with your doctor, what's a good first step for those folks? Anybody want to take that one, Jeff?
We get dozens of calls every day about people with who they feel they might have COVID-19 illness. If they don't have a medical provider, and it's a percentage of our Austin population, we basically say if you get severely ill, you have to see a medical provider. If you have no medical provider, then you may have to go to one of the hospital emergency departments.
And I would say, too, there are resources online. If they have access to internet services, there is a website called auntbertha.com that will provide them with the nearest local clinic. We have several federally qualified healthcare clinics here in the Austin area that can assist our an underinsured patient population.
And Serena, what is that website again?
It's auntbertha.com.
We got several questions about what I'm going to call reporting. And the questions go along the lines of this. If I see somebody in public coughing and not covering their cough, sneezing. Can I tell somebody? What do I do if a person is coughing and appears to be sweating? We got a question about somebody whose family members just came back from New York and they had symptoms of a fever, a cold, a cough. All these people want to know what options, if any, do they have if they think somebody is out in public with symptoms and not taking any precautions? I don't know who wants that one, Jeff.
So, no, do not call Austin Public Health
No,
or
but
even the state health department. But if, again, that messaging is about social distancing. If you see somebody ill, the importance is not about calling to report them. The importance is to avoid them. And more importantly, if you are ill, don't put yourself out in public. If you have a fever, stay home. If your child has a fever, don't send them to school.
So we did get a lot of questions about prevention and habits, and I want to talk about that now. Earlier in sort of the course of this, as the story was unfolding, there was a run on buying masks. Then I believe the CDC came out later, Centers for Disease Control, and said masks, actually don't do a run on masks, they're not that effective. Is that true, and why aren't masks effective in this situation? Serena, Dr. Hudson, anybody want to take that? When there was a lot of curiosity about masks and why actually it turns out those may not be effective.
Yeah, so masks are most important for health. We're trying to preserve masks for healthcare settings where you have symptomatic people, and we're also trying to protect the healthcare force. The need to walk around UT campus or the city of Austin down the sidewalk wearing a mask just does not make sense given what we know about this epidemic.
And a couple of issues with masks. One is if you use a mask incorrectly, you may end up actually touching your face more, and it leads to more of a possibility that you'll be infected if you come in contact with someone. If you happen to have acquired some masks in the early days, the most useful thing you can do with them is if you feel ill, if you think you may have symptoms, is to wear it yourself to protect from spreading to others.
We're all concerned that people with masks have a false sense of security, and that hand washing and social distancing is more important than going about your daily life just wearing a mask.
All right, so hand washing, 20 seconds, right? We got a question about hot or cold water. Does it matter? Whether you wash your hands with cold water or hot water, does it make a difference?
I think hot water or warm water is going to be better, but just the fact that you're using soap and water to wash your hands, and you're doing it frequently, is going to be more important than worrying about the temperature of the water.
Okay, 2 of the panel members are rubbing their hands to demonstrate. So tell us briefly about the actual technique for washing hands.
Yeah,
Somebody describe,
anybody
like,
in public health would say, sing happy birthday
Right,
to
20
yourself,
seconds.
and that's about 20 seconds. And,
Rubbing
to
the
lather
tops of
up,
your hands.
rubbing between your fingers, around your fingernails, the tops of your hands, and then rinsing it off with water when you're done.
So, yes, go ahead, Dr. Hudson. Okay, well, let's move on. We got a lot of questions about this, a lot of information. We got a question about acknowledging that hand washing frequently is very important, but also wanted to know about other things that we touch.
My name is Daniel Owen, and I live in Austin. And my question is, I understand we should wash our hands frequently, but what about our personal items that we may touch frequently with unwashed hands, like our keys, wallet, and smartphones?
What should we do about those items that we're touching all the time? Serena?
I think we do have to be mindful of those objects. And I know I was talking to a colleague of mine the other day, and I think it would be amazing to just do a little culture on my smartphone here, because I'm sure it's one of those things that we don't think about wiping down with a Clorox wipe every day when we come home. I know I've gotten into the habit of trying to do that because it's out in the open and it's exposed to anything and everything.
And another question kind of related to this, and it was touched on earlier, but I want to ask again, emphasize it. If somebody coughs onto a surface, a hard, there's a table in front of us, a hard surface or even a soft surface like material or clothing, how long is the virus alive on that surface? So in other words, we're using wipes, we're using hand sanitizer, but for what period of time would we still be at risk if we came across that same spot and touched it and then touched our face?
There's new research coming out about this week. it appears that the type of surface matters and that the range is from hours to days. Now, when you say live virus, that is what's still unknown. This is detectable virus by certain types of testing, but this is not, what is not known is whether it's infectious virus because it's alive and can actually be then transmitted to a person.
Okay, we have another related question. For years, we've been warned about overusing antibacterial products. Now, it seems like everyone is squirting hand sanitizers with abandon, among other things. Are we at risk for a whole new immunity problem down the road? So is it possible to be overusing hand sanitizer? And when should we use that as opposed to washing hands? We got a lot of questions about that. Everybody's smiling. Hand sanitizer.
Well, I don't know about when we can measure about overuse of hand sanitizer. Is 20 times a day too much? Is 50 times a day too much? I would say the hand sanitizers is important for in your car or to carry on you around your belt or in your purse. Importantly, when you're touching surfaces out in the public, lots of your listeners go and get coffee in the morning. You open the door with your bare hand. You're getting your cup from the barista who touched it. If you're putting half and half in your coffee, how many people touch that pitcher of, and then if you sprinkle some vanilla in it, how many people touch that vanilla container, and has that ever been washed in weeks? That's where you need the hand sanitizer in your car. So when you get back to your car, use some hand sanitizer to reduce any possible virus that may be on any of those surfaces.
I would add hand washing is just as effective. It's just hand sanitizer is more readily available. And now is probably not the time to be worried about overuse of hand sanitizer. We can solve that in the future. The next 2 months is the time to use hand sanitizer as much as possible.
And we got a question about another commonly touched surface.
Hi, I'm Aileen, and I'm calling from Austin, Texas. And I was just wondering about whether the coronavirus can stay on currency.
So dollar bills, change. Anybody know about the, people are shaking their heads no. Anybody have a sense of its lifespan on currency?
Yeah, in general, questions like that, if I get at the health department, that's a good question. And I don't think we're ever going to know that. But more importantly is it's staying away from those people who are coughing and sneezing that period. We know how it's spread. Whether currency plays a role, I don't think currency plays a role in this epidemic, but we do know that staying away from people who look sick and who are coughing and sneezing is probably the single most important thing.
And just to tag on to that and to repeat something I said earlier, staying away from people who are symptomatic is absolutely critical. But there is potentially a period before and after people have symptoms that they are still infectious. So that social distancing, isolation, quarantining for recommended periods is going to be essential to prevent transmission.
Lauren, you mentioned quarantining. We have a question about a habit with self-quarantine.
Hi, my name is Melanie. I live in Austin, and I was wondering about how to manage pets if I'm identified as having the virus and I have to be in self-quarantine. I live in an apartment, so I don't have a yard, and I have to take my dog out for walks 3 times a day. So I don't know what the restrictions are in terms of self-quarantine. Does that mean I can't go outside at all? I'd just like to know and have some guidelines on if I can take my pet out. All right? Thanks.
Yeah, so how strict is self-quarantine if somebody is either asked to do that or decides to do that?
Yeah, in Austin, Texas, we've had over 100 people who have returned from China who we've put in self-isolation for 14 days after they arrived in the U.S. And so that question came up early on, and what we have said is you can go out and walk your dog, just don't walk it with other people. You can go out for your run or your walk, and that's fine. We even said you can go into a takeout window to pick up food, but not go in the restaurant. You can go to a grocery store and get the curved delivery, but don't go in the store. So it's not an absolute that they have to stay in the house for those 14 days. They can go out, but we don't want them having contact with other people.
I think we've all been seeing reports and photos of people shopping in stores. You can't get wipes on the shelves anymore, just run on toilet paper. We have a question about sort of the impact of all of this and what's a reasonable response?
Hi, my name is Megan. My question is, how disruptive will this be in Austin? Is it really necessary to stockpile food and water? And what about services that deliver? Won't those also still be available? Thank you.
So should we be going to the store and stocking up? What are you all doing yourselves, and what are you recommending? Everybody's smiling. Serena?
I think that if you are over the age of 60, the CDC recommends that you do stockpile a few essentials. If you have the ability to get 90 days worth of prescription medications, then you need to obtain your 90 days worth of prescription meds and stock your house with non-perishables and things like that. For those of us who are relatively healthy, we don't need large amounts of toilet paper and hand sanitizer and those sorts of things. Let's save that and spread the love a little bit.
So we got a question about hospital capacity, specifically in the city of Austin.
Hi, my name is Catherine Blank, and I live in Austin, Texas. I was just wondering if Austin has the hospital beds necessary if this is a full-on pandemic, and especially are there enough ICU beds for people in case this is the worst-case scenario?
So what is our hospital bed capacity in Austin, if we begin to see cases that need hospitalization?
This is Jeff again with Austin Public Health. Remember that this isn't our first epidemic. We have a flu epidemic every year, and some bad epidemics of flu, we may run out of hospital beds. There is a limited number, and there have been recent flu epidemics where our hospitals are full. They're turning patients away because there are no beds. So we're aware of that, the hospitals are aware of that, and they have the experience on how to deal with that. But it is important. We don't know yet the impact this may have on our community and ultimately the impact it may have on the hospitals.
Can I add, hospitals have disaster plans to try to increase capacity. I would encourage us again that now is the time to implement the public health prevention methods so that we don't reach that. Italy has more hospital beds per capita than we do, and without prevention, their system has been overwhelmed, and we have the ability to change that now.
You are listening to a special hour about the coronavirus from KUT in Austin. We got quite a few questions from listeners about travel habits. Let's hear one of those.
Hi, I'm Bonnie Coffey. As a 72-year-old grandmother, how do I handle travel to go see my grandchildren? What is it I need to do?
So spring break is coming, families having travel plans, kids seeing grandparents. What should people do, and what should they be thinking about as that travel is coming up?
I think it's important to put into perspective why some of our larger events have been canceled here in the city of Austin. I think our Austin Public Health Department has done a great job of trying to decrease the risk and sort of flatten the curve, if you will. We don't want to see a huge spike because we don't want to overwhelm our hospitals and our healthcare systems. And so I think people need to think very cautiously about travel and where they're going and what they're doing from that perspective.
And I think there's two parts to that question. It's, should I go and travel? And if I am in a high-risk group, should I be visiting family members, children who are going to school who may be exposed to community transmission? And I think both of those, should we start seeing sustained transmission in Austin, both of those are probably things that you shouldn't be doing if you're in a high-risk group.
So we also got a lot of questions about vaccines. And as we get close to the end of our time here, we got a question about why there's not a vaccine available yet and when we might expect a vaccine to be available to the public.
My name's Connor Carricker, and my question is, why isn't there a vaccine available yet for COVID-19, and when can the public expect one to be available?
What is the vaccine timetable right now?
At least 1 year. It takes a long time to develop both safety and efficacy, which are so important before the sort of massive deployment of vaccines. Again, the vaccine is not going to be available to prevent this epidemic locally in the next 2 to 3 months. It's hand washing and the other things we've discussed.
Yeah, the Anthony Fauci, who's the director of the National Institutes of Allergy and Infectious Diseases, he said just a couple days ago that it'll take at least a year and a half. The trouble is this is a brand new virus. This is not like influenza, which is a known virus where we have the machinery to develop new vaccines every year. And if we're able to actually develop a vaccine in a year and a half, that would actually be a record, right? It typically takes, 5 to 15 years to develop vaccines for new viruses.
How long can we expect the spread of coronavirus and COVID-19 to continue? This goes back to late December. It's now early mid-March. What is the expectation as far as trajectory here?
The hope for me comes from Korea and China, where with aggressive public health measures, they have controlled their epidemic within 2 months.
So you're thinking about another 2 months or so?
Again, we hope not to have a peak, and even if it takes 4 or 6 months or longer, if it's a low level, that is better than the peak that's happened elsewhere.
You've been listening to a special hour about the coronavirus from KUT in Austin with our guest Serena Bumpus, Director of Practice for the Texas Nurses Association, Dr. Parker Hudson with Dell Medical School in Austin, Lauren Ancel Meyers from UT Austin, and Jeff Taylor, Senior Epidemiologist with Austin Public Health. I'm Jennifer Stayton.